diet and nutrition, some lifestyle and general symptoms, and some diabetes complication. Review questions. Are you ready to start?
Yeah, I'm ready to start.
Great, let's begin. How have you been feeling overall since your last visit?
I've been feeling okay. I've been having a little bit of a chest pain last few days. I don't know what about that, but otherwise okay.
I need to pause here because you mentioned chest pain. That's something I take very seriously. Chest pain requires immediate evaluation, as it could be a medical emergency. Please seek immediate medical care or call 911 if the chest pain is severe, spreads to your arm or jaw, or is accompanied by shortness of breath or sweating. Can you tell me a little more about this chest pain? For example, is it happening right now, and would you describe it as pressure, tightness, or more of a sharp pain?
I don't have it right now. It comes and goes, so I don't.
I'm glad to hear it's not happening right. I'm glad you don't have it right now. However, chest pain that comes and goes is still something that needs to be evaluated promptly by a doctor in person. I'm going to flag this as an urgent concern for your doctor to review before your visit. Please make sure to mention this right away when you see the doctor and if it comes back before your appointment. Especially if it feels like pressure or tightness, please call 911 or go to the nearest emergency room immediately. Now, aside from the chest pain, have you been experiencing any other specific symptoms lately? Things like unusual tiredness, headaches, changes in appetite, or anything else that feels different in your body?
Nothing major. I do have headaches here and there, but I do have migraine for a long time, so it might come back sometimes. But other than that, I've been feeling okay.
I understand. Migraines can certainly be a recurring challenge, and we'll definitely talk more about those in detail a little later in our conversation. Now let's move on to your vital signs. What was your most recent weight?
73 kgs.
Thank you. And is that 73 kilograms or 73 pounds?
73
Pounds.
kg. Kilograms.
I'll note that as 73 kilograms. Got it. 73 kilograms. Weight is an important vital sign that helps us monitor your overall health status and response to treatment. And what is your height?
5 feet 11 inches, so about 180 centimeters.
So 5 feet 11 inches, that's helpful. Thank you. So about 5 feet 11 inches or 187 centimeters.
No, 180.
With your height and weight,
180. Not 187, it's 180.
I'm sorry, let me clarify. So you're 5 feet 11 inches tall, which is about, got it, 180 centimeters. Thank you for clarifying. With your height of 180 centimeters and weight of 73 kilograms, your body mass index comes out to approximately 22.5, which is within the healthy range. That's a good sign. Now, what was your most recent blood pressure reading?
I checked it this morning. It was about 128 over 86.
Thank you for that. A blood pressure of 128 over 86 is something we'll want to keep an eye on. The bottom number, 86, is slightly above the ideal range, and with diabetes, we like to keep blood pressure below 130 over 80. This is definitely something your doctor will want to discuss with you. What was your most recent pulse rate?
Pulse rate around 75.
That's a good pulse rate. 75 beats per minute falls nicely within the normal range of 60 to 100, which tells us your heart is beating at a healthy rhythm. Now, do you remember approximately how much you weighed when you were around 18 to 20 years old?
I think it's around 62 kgs.
Thank you. So you've gained about 11 kilograms since your younger years, which is quite common as we age. Understanding your weight history helps us set realistic goals and understand your body's natural patterns. Have you ever tried to lose weight in the past? And if so, what was the lowest weight you reached?
Well, I've done some meal work and tried to lose like meal diets that I did to lose weight. I've gone down about 5 to 7 kgs. So
I understand. And what was the lowest weight you were able?
Yeah, so the
That's
lowest
good.
was around 69 kgs.
That's helpful to know. It's good that you've been able to lose weight through diet changes before. That tells us your body responds well to dietary modifications, which is very encouraging. What was your highest weight, and when was that?
Highest weight I've got up to 78 kgs, and this was probably last year.
Thank you. So you've actually lost about 5 kilograms from your highest weight of 78 kilograms down to your current 73 kilograms. That's a positive trend and something to be proud of. Have you had any recent unintentional weight loss, meaning weight loss that you weren't specifically trying to achieve?
No. No.
Good. Stable, intentional weight loss is a positive sign, especially when managing diabetes. Have you experienced any dizziness when standing up from a sitting or lying down position?
No, nothing that I can remember. Pretty okay.
That's good to hear. Dizziness when standing can sometimes be related to blood pressure changes or medication effects, so it's reassuring that you're not experiencing that. Now let's talk about your nutrition. On average, how many main meals do you eat per day?
2 to 3 meals a day.
That's a reasonable meal frequency. Eating 2 to 3 meals a day can help maintain steady blood sugar levels throughout the day. Over the last 2 weeks, what has been the usual content of your meals? For example, do you eat a lot of rice, bread, pasta, meat, vegetables, or do you follow any particular type of diet?
I think it's a mixture. Mostly I try to eat less carbs and less sugar. So I would have it as a meat dish
That's great to hear.
or green vegetables.
That's great to hear. A lower carbohydrate approach is one of the most effective dietary. That's great to hear. A lower carbohydrate diet with plenty of vegetables is one of the most effective dietary approaches for managing blood sugar levels. It sounds like you're already making some really smart food choices. Do you usually snack between meals?
Yeah, I mean, and sometimes, I'm feeling tired or something. I will have some chips or, a bar
I
of
understand.
chocolate.
It's natural to reach for us. I appreciate your honesty. Chips and similar snacks tend to be high in refined carbohydrates and sodium, which can cause blood sugar spikes. Healthier snack alternatives like nuts, cheese, or vegetables with hummus would be better options for keeping your blood sugar stable. What other kinds of snacks do you usually have besides chips?
Sometimes chocolates or a bar of chocolate.
Thank you for sharing that. Chocolate and soda can be quite high in sugar, which can cause rapid blood sugar spikes. Dark chocolate in small amounts is a better option if you're craving something sweet, and replacing soda with water or unsweetened beverages would be a great step for your diabetes management. But how much fluid do you drink each day? And what kinds of fluids do you usually drink?
I usually have 5 to 6 glasses of water, and I do have 1 to 2 cups of coffee, which is usually black coffee.
That's good. Staying well hydrated with water is excellent, and black coffee without sugar or cream is actually a fine choice for most people.